You'll respond in our next topic. And Senator, allow me to transition to the next topic because you also raised issues about the socio-economic issues affecting the country. That is the Social Health Authority. There has been challenges with education. There has also been challenges like what is highlighted, I believe it's on the front page of the Daily Nation with the housing program. All these are programs initiated by the current administration. We'll listen to what the president had to say yesterday about the Social Health Authority. But as we get there, Wakili Makanu.
Yes.
Help me, and I hope I pronounced your name correctly. Tell us about your observation about the situation with the Social Health Authority at a time that we are told nearly 600 members of the RUPHA are not admitting people that come seeking for services with SHA.
On this issue of SHA, I have been observing so many commentators make their comments.
Yep.
And I will begin it from the statement that was issued by the former Deputy President, that is Rigathi Gachagua. Mm-hmm. And I will start analyzing his statement based on this adage that says when an alligator comes out of water and tells you that the crocodile is sick, yeah, you have got no reason to doubt it. It's on record that Rigathi Gachagua said that SHA is a scheme that has been funded by close friends of the president. He did say that. Mm-hmm. He did say that...
Sorry, that SHA is a scheme that has been...
Yes, SHA is a scheme that has been funded by close associates of the president. He went even on to say that...
Funded?
It's being developed and implemented by people who are close to the president. That's what he said.
Okay.
Yes, if you have been listening, did you listen to his interview of last week, about a week?
No, I have a challenge when you said that it's been funded, mm-hmm, because the funding is coming from...
Including
let me,
and the exchequer, but carry on.
That is what he said.
Yeah.
That is what he said. I listened very carefully. Mm-hmm. But before I lose my thought of, my line of thought, he did castigate it to the extent that the whole process was opaque. He did, by insinuation, suggest that the tendering process, who is going to, who is going to manage the system? It has a system, the management system. He did say that, and these are things that we have not seen, because the ordinary way of things would have been that at least members of the public are invited to tender for the provision of the management of the system. Mm-hmm. We do not get to have an opportunity as Kenyans to be told who applied for the tender to manage the system, who was awarded the tender, and what are the considerations that they were looking for while they are awarding this tender. Mm-hmm. Number two, we have been told that SHA replaced NHIF. And if you look at the Social Health Insurance Act, under Schedule 2, there is a transitional clause which says very well that all the assets and liabilities that previously belonged to NHIF will be taken over by SHA.
Right.
So today, when we see the hospitals and the service, the hospitals that have been empaneled, or those ones that were in NHIF and have now transitioned to SHA, yeah, coming up and saying we are no longer going to make use of SHA, yeah, because we have not been paid, it does not come as a surprise. It doesn't come as a surprise because it takes us back to ask these questions. What was the need of rushing the implementation of SHA without first developing something like a pilot project? Let's say start with 5,000 civil servants or employees, mm-hmm, or 5,000 people. Test how it works before you can fully transition. In law, there is something called shifting of the burden of proof, whereby if matters exist within the peculiarity of your knowledge and someone raises it, then you have to come out and clarify. These gaps that we are seeing in SHA, yeah, it could only lead to one thing, that SHA is the biggest heist that probably Kenyans are witnessing, and it's just a matter of time before we discover. Because the questions that I'm asking, who was given the tender for the management of SHA? When was the tendering process done?
You mean the technological system?
Yes, that is it. Because I saw somewhere recently, there is someone who registered and did not include dependents or beneficiaries. 2 months down the line, he comes up and says, he comes and sees in the portal that there is a beneficiary who has been added into his portal, and he did not add that. So what does that tell you? That the system is being manipulated from somewhere, you know? So, and this mirrors very clearly with the questions that I'm asking. Why was the tendering process opaque? Okay. You know?
All right. Yes. Let's listen to what the president said yesterday. Is it yesterday or over the weekend? Yes. About, yes, it's actually yesterday, about the situation with the Social Health Authority. Watch this.
Kama hakuna mpango na taratibu ya sawasawa kwa hospitali, mambo yanaweza kwenda mrama. Na ndio sababu tumesema tuwe na mfumo wa afya ambayo itasaidia wananchi wote bila ya kujali uwezo wao wa kifedha.
It is now serious. Let us pull together and figure out if there are any hiccups, how do we unite and sort and smoothen them? But the reality now is that there is no more money that can be doled around kugawagawa kwa mambo ya health kwa dunia hii.
So the president spoke on Saturday at the Baringo funeral of the former senator, or Senator Cheptumo rather. At the same time, Senator Khalwale was somewhere speaking at the same time CS Baraza of Health.
Please, there's a problem. I watch you on TV as you struggle to explain about SHA and SHIF. Minister, that noise is not going to end. In fact, you are lucky that you are doing it on TV.
Universal health coverage leaves no one behind. It does not depend whether you're rich or poor, you're vulnerable, you're needy. God has given us a time so that we can speak for the voiceless in our community. And for us as leaders, we are being called upon to unite and make this work for the good of all.
Okay, so also the president yesterday admitted that there are gaps, but he says, believe you me, it is going to work, end of quote. Senator Tigei,
yes,
we're being called to unity. What does unity do to SHA?
Thank you, Sam. I want to speak to Kenyans about this thing. When I hear my colleague Wakili talking about the issues he has raised, when I hear another Kenyan out there saying that SHA does not work, leading to a conversation that we're having right now, it is because of the question that you had the Honorable CS and the Honorable Boni Halwale talking about in that clip. Given SHA has got its challenges just like any other, and it is not going to be, I would say, smooth. You know, governance of any aspect it's a human, and you know, it's a human interacted or interactive aspect. It can never be perfect. In this aspect of SHA, Sam, there are issues, there are challenges that the president is saying, the PCS is saying, and the rest of us are saying. But the question is, do we speak to those specific challenges so that we get to know that it could have been a challenge to a specific individual in a specific health facility, or it's a challenge with regard to SHA as a product of universal health care the government is trying to roll out? There are two things that I want to say. It is true that sometimes people do not get to be assisted in a hospital environment because of non-approval from SHA, for example, or it has been declined. Because ordinarily, I, first of all, must have registered as a member of SHA. I must be attended to in a hospital, and a requisition is made for purposes of payment. That is why that the OTP that people say it could delay, it doesn't come, or it sometimes even gets delayed. What happens when that occurs? You are either asked to pay cash, or you definitely, if you've got no cash, you will probably not get medical attention. The consequences of that is that particular patient will definitely go out and say, SHA does not work because he's not been treated, or he's been treated subject to a cash payment.
So is it working or not?
It is working some. Two, sometimes hospitals, because of the delay in payments, decline to offer services. And it is provided. Last week, the CS for Health was in Parliament. She was in Senate. And there was a question that had been asked by my colleague, Senator Kio Wambua, with regard to SHA. And she ran the House with, of course, a lot of struggle. And this is where I was saying, yes, if and when I speak here, Nyutu will say, I am speaking in support of SHA because I'm supporting government. And he's entitled to do that, right? He's entitled to say that I'm saying SHA is working because I must support the government. I do not want to join the chorus of that bit. I would rather run Kenyans to understand that though we still have challenges, SHA is working. When these hospitals also demand payment of cash, it is not because they do not want to support this program. It is because there has been delays in payment. The CS gave us statistics of how much it's outstanding, and it's true. When NHIF and SHA was transitioning, that is, SHA actually was fully rolled out on the 1st of October 2024. That is when SHA received contributions from members. The law was passed in 2023, a one-year period.
Yes.
So there are certain hospitals that still have got outstanding remittances from...
Did she say how much money has been collected?
Yes, I can give you the stat. I have a document that she submitted in Parliament. It's a public document. I'll give it to you. But I wanted to explain to the Kenyans. Yes, around 20 billion as it now in the accounts as of 18th of February. But what has been paid out is 18 billion Kenya shillings in various accounts. I will share with you that document in a moment, and probably so that actually she gave specifics. This is as of where is this? It's here. As at the time of the transition, NHIF had in its accounts 1.4 billion Kenya shillings in what is broken down into various accounts, collection accounts. And we've got collection accounts, just try to say this, settlement accounts and operations account. Cumulatively, it was 1.4 billion Kenya shillings.
All right.
Now, fast forward, as at 20th of, as the 31st of January 2025, now having transitioned from NHIF to now SHA, they had collected 20.9 billion. And what has been paid out is 18.2 billion.
18.2 billion?
Yes, that document is available. It's there.
Okay.
Now, what is ailing part of the implementation of this program is, for instance, this 18 billion that has been paid out does not fully cover all the payments due to all the hospitals that participate in this program. And that is why sometimes they say, like for instance, I come from Bomet. Tenwek Hospital is a mission hospital. That is one of the most important and critical institutions within the county. But they are owed a lot of money, and therefore sometimes would say, we need to be paid before we offer these services. And they're entitled to say that, because if they can't afford to pay their salaries...
If that is the situation, you still think SHA is working?
Yes, it is some. Because...
Is it working in Tenwek?
It is working in very many other hospitals. I gave you Tenwek as an example.
Is it
because
working
they raised it and I come from that county. Yes, it is.
Even when they are not paid?
It is working. They have raised the concern. They have had a session with the president, remember, a number of those churches, and a commitment was made that despite these challenges, we are committed to do it. Remember, Sam, we are looking at 19.4 million Kenyans having registered for SHA. and about 4 million are only contributing to it.
Yeah.
And it should be now a conversation where you are saying, having had this clear communication to the people of Kenya, all these hospitals also have already been onboarded, and a payment is made to be consistent. Remittances are done in good time.
All right.
There are no delays.
Okay.
Every other hospital that has goodwill to serve Kenya, to help this program, will ultimately get to be paid what it's supposed to be.
Okay, but you know, goodwill can only go so far because you need resources to run the hospital, really.
It's true. That is why I'm saying, admitted, there are challenges with the implementation of SHA.
Let's listen to
but it is working.
Let's listen to what the president said yesterday.
Kwa sababu it is the biggest program tuko nayo kwa taifa la Kenya, pengine itachukua muda ishike laini, lakini believe you me, it is going to work. Believe you me. Tunaamini Mungu, Kenya hii itabadilika.
Believe you me, it is going to work. Is it working in Murang'a, Senator?
You know, Sam, the private hospitals have stopped attending patients who are covered by, under SHA. And of course for good reasons. And we have also listened to the Kenya Union of Clinic Officers and the many things that they are saying. And that the only part of SHA that is working is that part, according to KUKO, is that part that is being financed from what contributors have actually contributed. So primary health care is not working. That is supposed to be financed by the government, not by the contributions. And then there is this critical and emergency health care that is also supposed to be catered for by government. So the only area, the only thing, according to KUKO, and I know you know that, is that is working is the part, I think, that is SHIF, where, and that is for the people that are contributing. Remember, Kenyans have been told to contribute, to register, whether they are contributing or not. The government under this program promised that it was going to pay for those that are vulnerable and they may not be able to be contributions. But having said that, Sam, the statement by the president, which you have just read, contradicts all what Senator Sigei and the brigade have been talking about. The SHA is working. The president himself confessed yesterday that it will work in the future, meaning it is not working now. When there was that particular retreat in Naivasha before, sittings resumed, members of the National Assembly, including Kimani Ichung'wah, the majority leader, raised the issue and said there were problems with the SHA chief. But when they come here, when they go out there, they raise the issues with the CS Health. When they go out there, they've been saying it is working, it is working. That is what Senator Sigei is saying. The president now has accepted that it is not working, but will work. So you do not need actually to go far. And the people are complaining all over. That is why there is even a lady that, together with some other patients and family members, that stormed, Afia House, because it was not working. Had it been working, those things would not have been there. But then when we speak about this, we are told it's only because we are not supporting the government. And I tell you, some because you have also read the clip by Honorable Khalwale, Senator Khalwale. I pity the CS for Health, Barasa. Because this is somebody now being blamed for systemic failures. And when she appeared in the Senate on Wednesday, in my contribution, I said, because she got a very big tongue lashing from the majority leader, part of which I agreed with, that the Senate needs to be recognized and, respected just the way they behave towards the National Assembly. But then my rider was, and if anybody goes to the Hansard, they will see. I said, I hope that the tongue lashing by the majority leader is not supposed to lay ground for firing some people. Because I fear that this CS and the PSs there could be axed, not because they are not doing what they're supposed to do, but because there is a problem with the system, and of course they are the punching bags, some. And some, if you allow me, just a rider, Jean Kagiri is elected in Laikipia County to speak for Laikipia. She was speaking previously for Northeastern and saying how the president is working very well. That's why she was not able to tell you whether she knows that road. I mean, there's a reason why we are elected in our areas. Okay, and finally, we should not blame Gen Zs. Yes. You know, she talked about tourism going down because people are talking about bringing, you know, complaining about things that government is not doing. And she specifically mentioned about the Gen Zs. So Jane Kagiri wants the nation to believe that when issues rise, I mean, when there is dissatisfaction in the way government is being ran, that we should not talk about it. Otherwise, if we talk about it and revolt the way the Gen Zs did, then we are preventing, we are discouraging tourists from visiting our country. I mean, that is an argument.
You made your point.
Thank you.
I could see that there is comfort on the face of Senator Sigei, but before I get you there, Mheshimiwa Kagiri,
I actually restrain myself some.
I noticed. Please note it down. I'll give you an opportunity. Mheshimiwa Kagiri, so if the president admits there are challenges, what is the solution?
First, I think Senator Nyoto is very well versed with this year's theme of International Women's Day. It's called Accelerate Action. The number of times you have mentioned Jane Kagiri on this show shows your appreciation for women, their brains, their capacity, and what they can do. So I appreciate you for that. And please keep doing it at the Senate and also in Murang'a County. Empower your women. That said, Sam, you've asked me in regards to where we are at with SHA. And I appreciate that the president acknowledged and accepted that there are challenges with SHA yesterday. And some, for me, it's good to mention and tell Wakili. My background is computer science. And nobody should ever be lied to that any system is foolproof. There is always room for error. And that is why we pilot projects. And a pilot can even run up to 1 year. So when you see a wrong entry, that is bound to happen, and I'm sure it can be corrected. And necessarily does not mean that it is somebody who did it. It's just an error on the algorithm which allowed another entry to put details into somebody else's details. So that said, Sam, I would also want to mention, I think I'm beginning to feel that even as media, you need to hold us accountable for each and every word that we say out here. Some have been seeing a lot of members of parliament who accompany the former deputy president criticize and talk about SHA, SHIF, they even call it SHA, whatever. But some, we passed this bill in parliament in, I think, October 2023, where we brought in the fund of primary healthcare fund, we brought in SHIF and the emergency and critical illnesses fund. So when somebody out there is criticizing something that they approved and passed in parliament, they need to tell their electorate, is it that they were absent in parliament on that day, or is it that it was passed without their knowledge of what was being passed? So I believe, especially for members of National Assembly, when we stand to speak about SHA, we should be speaking about it constructively, because for me, the one thing I must state. And I keep saying whenever I'm on this panel, each one of us, it's very easy for us to say, SHA is not working, we can do away with SHA. But that's because hidden in our pocket, we have a medical card. What happens to the poor person in this country who has no medical cover or somewhere where they can run to? For me, I would say SHA must work, and it must work for us, for every Kenyan, by us fixing the challenges that are there. For me, I've walked around my county, and I gave you the last time, I think I was here, an example of a lady who told me in a place called Morocco that SHA paid for her 300,000 for operation on her leg. Another lady said her daughter had been in the Kenyatta National Hospital for a whole month, and she was paid for the bill by SHA. When I left the studio, many of my people called me and told me, Jane, we have no dispute. Inpatient is working, outpatient is not working. So those are some of the challenges that we are going to be highlighting to our government. The second thing, is there's something called the means testing. That is also another challenge our people are encountering. And I'll give you a very clear example of somebody who rents a house somewhere in Majengo, maybe in Nanyuki. The floor is concrete, the walls are concrete. When they go to the means testing tool, it has no room to ask them, is that your house? So it just asks them, how is that house constructed? By assumption of the tool, it is assumed that the person is wealthy by virtue that they're living in a concrete house. But nobody stops to wonder, are they renting that house or what's the situation?
But I asked you, what is the solution?
So that's what I'm saying, Sam. Those are the challenges we have picked, and those are the ones that we have to fix. And the proposal most of the public have is, why don't we put a flat rate for anybody who is unemployed or anybody who has no actual source of income. That way they can work hard, ensure they raise that monthly contribution, and they are assured of their health care being taken care of.
All right. Still so much work to do there, and we'll continue the conversation as we progress with the week. I just want us to take a look at something here that is on page 12 of the Standard. It's the editorial cartoon that shows... yeah, there you have it. I don't know if you're able to see that. So it says, I am consulting widely on my next move. That is from the podium. And then you see
consultations.
The person
and then he changes the camera.
Rest in written consultations. Your mic is on, but you can express yourself. What do you think about the editorial cartoon? Titus, I can see you. You want to say something? Just say it.
Yes. I've seen that editorial cartoon, and it mirrors exactly what I said at the beginning of this show. It appears there's someone who is saying that he's consulting widely on his next move. And we know that that person has been Baba, saying that right after he came from AU, he was called to State House Mombasa, where he met the president and his people, and he was told to sign some agreement, but he said, give me some time so that I consult my people. Now, right under that cartoon, there is also another picture of someone who appears to be Baba, but now he says he has consultations, putting on a different cap, a hat, different in color, and a different tie.
Is the background deliberate? Looks yellow?
The background looks deliberate. It looks yellow, and it appears to be very deliberate. So for me, just very briefly, for me, I think Baba is trying to play safe on this whole issue of engaging with the president and his government as is concerned. He knows very well that on one hand there's the wrath of Kenyans and the wrath of the Gen Zs, such that if the perception is that he has betrayed the people of Kenya to join hands with the president who has come up with bad policies, then there's a chance that both of them are going to be sent home. Packing
there's another
in 2027.
On page 15 of the Daily Nation, so it looks like there's some officials appearing at the Registrar of Political Parties, and there's one shouting there, can I rebrand to Lies Party of Kenya? I'll get away with never telling the truth. Page 15. You found it, Senator Sige?
Yeah, I got it. It's here.
Yeah, I don't know.
This should be for Senator
of political party.
You're saying it should be for Senator Nyoto?
Yeah, because some, and that's why I said you need to start holding us accountable. You know, sometimes I listen to the things they say, and I've given a good example. We pass something in Parliament, they go on media and criticize it. Yet they're the ones who passed it. Number two, recently I had the former deputy president talk about fights against women. And he said you never fight with a woman. But years ago, he was the one fighting Lady Justice Esther. So has the gender changed? So when we talk of unity, that His Excellency William Ruto is not uniting the country, what about them? What did the former deputy president do when he was the deputy president? Did he unite us? The answer is no.
All right. Senator, 10 seconds.
Yes. No, you'll give me more because the reason I restrained myself is...
I also need to say something about the cartoon. I've been accused of...
Okay, thank you.
Yes.
You see, I earlier on said we owe Kenyans an obligation as leaders to tell them the truth. It is not all the time politics. It's not all the time who can say what is popular and not. Nobody has just taken time to sit back and listen to the concerns we are raising and tell Kenyans, look, when we talk about the cost of living, it has been the easiest thing to say the cost of living is going very high. No one would sit back and say, let's talk to Kenyans about the cost of unga in 2022, in 2023, in 2024, and now in 2025. Because it's come down. We're talking about 122 shillings thereabouts. 29 actually, it's actually 129 the cheapest. It was 200 and over then. So we need to debunk this narrative so that we avoid politics and tell Kenyans how best it has happened. Because SHA is a transformative thing. We cannot just tell Kenyans it's not working when a good number of them knows that it is working despite with challenges.
Senator Sige, please allow me.
So I think that is the obligation that we have as leaders. We look forward to Kenyans being people who can appreciate
that though there are challenges, there is hope that it will ultimately work and serve the objective that it was put.
Hope is the one.
Some very quickly, because Jane has said that this cartoon on the nation should come to us.
Again, you mentioned.
Actually, yes, you have mentioned me also.
Yep.
Jane is a very smart lady when it comes to languages. She did not read, can I rebrand? Not a brand, a rebrand.
Yeah.
To Lies Party of Kenya. Nobody in this country does not know who the king and the high priest of lies is.
All right.
That is the person being referred here. Thank you very much, Sam.
Senator John Nyoto, Mheshimiwa Jane Kagiri, Wakili Mahanuta, as well as Senator Wakili Hilary Sigei. Thank you so much for making time for us of this conversation. Up next is Sporty Monday. See you tomorrow.